The fight against COVID-19 continues with increasing concerns about the Delta variant.
Joining us with more on the threat is internal medicine specialist Dr. Abha. Doctor, good to see you. Thanks for being with us.
Good morning, Mike and Brody. Thank you for having me.
Absolutely. Well, let's start with this variant and how much noise is it making now here in the States?
Thank you for the question, Mike. It's becoming quite alarming in that 20% of the prevalence of cases in the United States are attributable to the Delta variant. We've heard our neighbors across the globe are now reissuing mask mandates and social distancing to include Australia, New Zealand, and Israel. Israel enjoyed the earliest reopening of its country back in March, when 80% of its eligibles had been inoculated with the vaccine. They've rolled out their program expeditiously. We in the United States are no different. We too have enjoyed a very rapid and fast rollout, especially among our most vulnerable population. And yet we are still prey to this Delta variant that is highly infectious, highly communicable, and possibly more deadly.
Well, we understand here July 4th, that was obviously President Joe Biden's goal of having 70% fully vaccinated here in our states. Is there a concern much similar to what we're seeing in India? Or let's talk about those rates and how it translates to the Delta variant.
So if you look at certain data trackers, such as on Bloomberg News, that goal of 75% of Americans inoculated by July 4th was based on a trajectory of 3.4 million Americans getting the jab on average per day. Now, 800,000 Americans are getting the jab per day. States are turning away their vaccines. It is not for lack of vaccination that our rates are lagging. It is for lack of interest. And so based on a new trajectory, it will take 6 months from today for 75% of Americans to be duly inoculated and hence protect the rest of us from the ravages of things like the Delta variant. And make no mistake, the Delta variant is merely the most recent highly infectious variant out there. More mutations will arise, more variants will arise. And the biggest concern exists for these varying viruses to then evade our vaccines. What does that mean? For the 50.5% of Americans and Michiganders who have complied with the race to the jab, we are then questioning, will our vaccination efforts have been for naught if those who remain non-inoculated have the potential to get infected with highly infectious variants? My point being this: please get the jab. I am not here to scare you. I am here to inform you. Every single day, I have to work even harder to spread the same message of hope. We can open this country up again, but you must get the jab. The Delta variant is here in the United States. Today, we are at 20%. In 2 weeks, we could be at 40%. And by mid-July, it could be well over 50% of the prevalence in the United States. It is going to overtake the original UK or Alpha variant. And its infectiousness gives me great concern as a doctor.
All right, Dr. Abha, thanks for being with us this morning. We really appreciate it.
It's always a pleasure. Thank you for your time.